What will the future of healthcare look like with the rapid advancement of technology? Imagine a world where nurses have an extra pair of hands, not of flesh and bone, but of data and algorithms. Artificial intelligence, or AI, often conjures images of robots and futuristic cities. At its core, however, AI is a branch of computer science that aims to create machines capable of intelligent behavior. This includes learning from experiences, solving problems, and adapting to new inputs. To understand AI, one must grasp its main components: machine learning, natural language processing, and robotics. Machine learning is the heart of AI, allowing systems to learn and improve from data without being explicitly programmed. Natural language processing enables machines to understand and respond to human language, a crucial aspect for patient interaction. Robotics, while often visually striking, plays a role in automating physical tasks, which can be particularly useful in a healthcare setting. Now consider the role of AI in nursing. Nurses are the backbone of healthcare, providing care, monitoring patients, and making critical decisions. AI can support these roles in several ways. For example, predictive analytics powered by machine learning can analyze vast amounts of patient data to forecast health trends and potential emergencies. This allows nurses to prioritize care where it's most needed. Furthermore, AI can automate routine tasks such as scheduling, data entry, and even preliminary diagnostics. This not only reduces the workload on nurses, but also minimizes human error, leading to better patient outcomes. In summary, artificial intelligence in nursing doesn't replace the human touch, but enhances it. It provides tools that help nurses manage the increasing complexity of patient care, making healthcare more efficient and effective. As we move forward, the synergy between human compassion and artificial intelligence will define the new era of healthcare.